ology means study. That means it is the study of the people or study of the people. The basic definition, the important definition which you want to learn for this subject is the study of distribution and determinants of health related states or events in a specified population and the application of the study to the control of health problems, given by John M. Last in 1988. Now, what does this definition means? The study, basically, epidemiology is a study of distribution and determinants. That means whatever health related problems, whatever health related risk factors, or health related prevention strategies, all those how they are distributed in the population and what are the determinants. That means what are the risk factors for these, we need to find out. Okay, so that is distribution and determinants of health related status and events. So whatever related to health, whatever related to health, how it has been distributed in the population and why they become the reason for that particular disease in a specified population in which you want to do your study, and the application of this study to the control of health problems. So once you know these are the problems that the particular community is facing and these are the risk factors or the determinants of this particular disease, you can apply a strategy so that you can prevent that disease at that particular point, or you can plan a strategy where you can actually give some treatment to that particular people or that particular community. So that is the meaning of this definition. Now we'll be moving forward. So just brief history of epidemiology. The very first person who invented epidemiology was Hippocrates. Used to happen before Hippocrates is people used to believe in some supernatural powers, and they never used to believe that the disease used to have some reason, but they used to say it's a wrath of God because of which we are falling ill, and there is nobody who can actually help us. So Hippocrates was the first person who thought scientifically that there may be some reason because of which people are falling ill. So nature is the healer of the disease, that is being said by the Hippocrates. Environmental factors can influence the occurrence of the disease. So he was the first person who said, no, God is not behind everything, but there are some environmental factors because of which you may be falling ill for that particular disease. He conceived the relationship between habits, whether it is bad or good, the physics, the weather, and disease. That's why he said, if you have good habits, you will have good health, whereas if you have bad habits, then you'll have a bad health. So he was the very first person who conceived that relationship between this habit, physics, weather, and disease. Then came Thomas Sydenham in 1624 to 1689, who stressed the importance of careful clinical observations. So what he has to say is, do not go by whatever other people are saying, but you observe whatever is happening over a period of time. See the path of the disease, how the disease is progressing, and where can you stop that disease from happening, and what are the preventive strategies. Then John Snow, he came and rightly known as father of epidemiology because he did something which act into epidemiological way. Before this time, there was no concept of epidemiology. People used to treat only the deceased person, but to treat the environment or to understand the environment because of which the disease is happening, that has started with John Snow. That is in he that is between 1813 to 1858. So he found out what caused cholera. Best known for his work on cholera and anesthesiology, considered one of the founders of modern epidemiology. In 1840s, he pioneered the development of equipment used to administer patient safety. His greatest contribution was demonstrating that feces contaminated the water, and that was the source of cholera infection. So what basically here happened is there was a cholera outbreak in London. So there was a one Broad Street pump which was contaminated. The water was contaminated, and people who were having water from that particular pump, they used to show symptoms of cholera. Now, what John Snow did is he plotted on a map of London. He plotted a dot for every single person who is infected. And he found out that people who are actually having water of that particular pump, they are seen to be infected. So he painted that Broad Street pump into red color so that people will understand that water from this source is not edible, or you cannot use this water. So once he did that, people were isolated, people were not having water from that pump, and they started having water from somewhere else. And thus the reason for cholera, and there is a prevention of cholera in that particular area. So that's why John Snow is known as father of epidemiology. Then came William Byrd in 1811 to 1880. He did study on typhoid fever. Then Sir John Linker in 1803. This was the first dental study, epidemiological study he performed. He collected details of health habits and dental state of 96 old men, all above 80 years. Then came the Edwin Sonder in 1837. He saw the data for eruption of teeth between ages of 9 and 13, and so concluded the eruption pattern of the teeth. His report is known as the teeth, a test of age. That means the teeth can determine the age of the patient. Then came William Fisher. He contributed in initiation and development of school dental health services. So this was a brief history. Now we'll see what is the difference between general clinical medicine and epidemiology. So in epidemiology, the unit of study is population at risk. That means the entire community, not only a single person. Whether that person is diseased or not diseased, that we do not consider, but we consider the entire population. Where in clinical medicine, we generally see only cases, people who are having diseases. The second is investigator goes to the community. Here, the investigator wants to go to community. The community doesn't come to the investigator. Whereas patient come to the doctor to find out the solution of that particular problem. And thus one-on-one interaction is there. Whereas in community epidemiology, there is one-on the mass interaction or the mass approach is used. Then epidemiology, source of infection, mode of spread, etiological factors to determine future trends or recommended control measures are found out, okay, in epidemiology. Whereas in clinical medicine, there will be diagnosis, which derives prognosis to the prescribed specific treatment, and ultimately there will be the patient will be given some treatment to cure that disease. There won't be any prevention, but to cure the disease. In epidemiology, there will be conceptual tables and graphs used to display the finding. Whereas to display the finding in a simple case or a one person's case, there will be reports which will be displayed by that particular clinician. Okay, so this is the uh, difference between epidemiology and clinical medicine, and this can come to you as a short note. So now we can move ahead with the principles of epidemiology. So first is exact observation. That means strict, vigorous, accurate, and precise. So your observation should be strict, means vigorous, accurate, and precise. That means whatever you are saying, you should see it precisely. You can be able to describe it precisely how it is, how it was in that particular patient. Then correct interpretation, which should be free from error. So whatever you have observed in that particular person, with the help of the knowledge that you have in that particular field, you can actually interpret it, whether which kind of a disease is that, or what kind of a risk factors are responsible for that particular disease. This you have to interpret the data without any errors. Then rational explanation, that should be intelligent, sensible, and reasonable. So the explanation given should be intelligent, sensible, and reasonable. So whatever you're interpreting out of that observation, there should have some explanation. And that explanation should be based on some scientific knowledge. You cannot just randomly say something. You should have some backup for your saying. Then scientific construction by expert knowledge and technical skills. Once you know what exactly has happened into that particular community, you can construct a scientific construction is there, where you can actually construct some plans so that you can prevent that particular disease from that particular community. Now, basic measurements of epidemiology. Okay. So, how we have some tools, or otherwise, how do we measure things like that? We have to measure how much is the amount of disease in that particular society or that particular community. Then only we can plan a program effectively. By that, we'll be knowing how much is manpower that we need, how much is the feasibility, what will be the time span through which we have to go, and how much is the expenditure. To know that, we have to measure the amount of disease or the burden of the disease that particular community have. So for that, we have various measurements like mortality rate, that means the death rate. Then you morbidity rate, where the people are having morbidity, that means they have the disease has affected their life in some or the other way, but they are still alive with that morbidity. Then disability, that means the disability or the loss of function caused to that particular person because of that particular disease. Then you have presence, simply presence and absence of disease, presence and absence of etiological factors or the risk factors, demographic variables, various demographic variables. Now, since we have to measure these diseases, we want to measure these diseases, we need to have some tools. For example, if you want to measure a height of a person, then you have to have a scale, which is a tool with which you can actually measure the height. So, what are these tools in epidemiology? These are specifically rate, ratio, and proportion. So first we'll go with rate. Rate, it measures occurrence of some particular event in a population during a given time period. That means how much amount of disease has been happened in that particular population in that particular time. That is determined by the rate. For example, death rate, that is number of deaths in 1 year that has happened into the entire population into thousand. So here we can see in this example, it has numerator, which is number of deaths has happened into that particular population. Denominator, the total midpoint population, the total amount of people there. Time specification, that is of 1 year that we have considered, and a multiplier, which is 1,000, which depends upon the amount of the population that we are taking into consideration. So in rate, the important thing is numerator is always a part of denominator. That means the number of people they have died of that community or that particular disease, they were counted when we count the denominator, when we count the number of people which are present into that particular community. So that is a speciality of rate. Okay, now rate, ratio, proportion can also come as a short note to you and can be asked as a viva question to you. Then second is ratio. It expresses a relationship in size between two random quantities. Two random quantities. For example, as we take example of gender ratio, that is male is to female. That means how many females are there for how many males, right? So that is a random quantities. So male cannot be a part of female population and female cannot be a part of male population. So these are two random and different quantities. Result of dividing one quantity by other. For example, doctor population ratio, where number of doctors at a certain point of time divided by number of patient they need to see or number of people they want to see. So what do you come to know by this is the numerator is not at all a part of denominator. The doctors are not counted into patients and the patients are not counted into doctor. The numerator and denominator may involve an interval of time. That means they are taken for that particular interval of time that we have already considered into rate, that is over a period of time, that is either 1 month, 1 year, 10 year, depending upon the situation. And it is expressed in the form of x is to y or x by y. Now, third quantity is proportion. It is a ratio which indicates the relationship in magnitude of part of the whole. That means a part of the whole. That means, for example, if you are having a pizza, then if you are taking one piece of a piece out of it, so that the entire pizza is 100%. And if you're taking one part of it, that may be 25% of that pizza. So magnitude of the entire thing. How much is the magnitude of that particular disease in that particular population? So for example, proportion of children with dental caries. So the formula says is number of children with dental caries at a certain time divided by total number of children in the village at the same time. into 100. So here multiplier is fixed. In proportion, multiplier is always fixed. So we can see that number of people who are or children who are having dental care is divided by total number of village children in that village into 100. So what does this signify? The numerator is always a part of denominator. So when we say the total number of children, that means the people or the children who are having dental caries, they are also included. That's why the numerator is a part of denominator, and the proportion is usually expressed into percentages. Since we have multiplier which is fixed, which is not there in rate. Rate have different multiplier depending upon the population. Here the multiplier is fixed, which is 100. That's why we express it into percentages. Okay. Then, how do we measure individual things like mortality, morbidity, and what are the use of it? So, measurement of mortality, mortality being mortal or susceptible to death. Okay, means you can die and you can be susceptible to the death. This is the easiest data that we can collect. We just need to know whoever is live and whoever is not live. Provide starting point for majority of epidemiological studies and use as public health indicator. Yeah. So there are various types of mortality. That is crude death rate, basic. That is crude death rate. That is number of deaths per 1,000 people in a population given a year. That means the number of people who have died in that particular population divided by the entire population into 1,000. This is the simplest measurement. Then the specific death rate means because of specific reason. So there will be number of people died due to that specific reason. For example, number of people died due to corona in year 2020 divided by number of people who are there into 1,000. Then age specific death rate means you have to specify the age into only in that age how many people have died in that particular year we need to find out. Then the case fatality rate means how many people have died because of that particular disease. To find out how much fatal that disease is. How much fatal that disease is. So that will be number of people who have died of that particular disease divided by number of people who are affected by that particular disease into 1,000 or 100 depending upon conditions. Then proportional mortality rate means there will be proportional of various reasons. For example, in this community, there will be 100 deaths because of some reason. 30 people might have died of accident. 20 might have died of some cancer. 10 might have died because of the age. So how much is the proportion of the population which have been which are dead because of that particular disease? So we have various proportions that 30% people died of accident, 20% people died of some cancer, 10% died of because of the older age. Okay. And the last is infant mortality rate, where we have death occurring into children which are less than 1 year of age. Less than 1 year of age. Okay. Then what are the factors affecting this mortality rate? Birth rate. If birth rate is more, then there will be less amount of mortality rate since your denominator will increase. Density of the population is dense into a small area. There is high amount of mortality because of division of basic resources. If there are less amount of resources, people may die. Geographical distribution, so people staying in a hilly area or difficult area to stay, they have less lifespan as compared to people who stay on a flat area. Then seasonal distributions, epidemic experiences. So suddenly if there is an epidemic in that particular area, suddenly there is a surge of mortality rate as we have seen in the time of corona. Secular variations, like variation in two different ways. Then if we have measurements of morbidity. Morbidity means any departure, subjective or objective, from a state of physiological well-being. The person who were ill, the person who were ill, duration of these illnesses and diseases, for how much long, like for it's a short duration disease or a long duration disease. Then there are various aspects of mortality, morbidity here, like frequency, duration, and severity, that is determined by morbidity rate and ratios. So disease frequency in this case is equivalent to incidence and prevalence. So we'll be knowing what is incidence and prevalence. So there are various uses of this morbidity data, that is to describe the extent and nature of the disease, how much is the disease burden is there, essential for basic research. So once you know how much is the burden of the disease, then only you can plan a program to either prevent or cure the disease. Serve as a starting point for epidemiological studies, play a crucial role in disease prevention, needed for monetary evaluation and disease control activities. So I was saying that the morbidity can be calculated with the help of incidence and prevalence. So what is this incidence and prevalence? Incidence is the number of new cases of a specific disease occurring in a defined population during a specified period of time. So incidence means all the new cases that has occurred into that particular population because of that particular disease, not the previous cases which were previously diagnosed, but during the study, which are the new cases which have been diagnosed. So it is generally measured into form of a rate, that is incidence rate. There are two types, that is episode incidence, where the rate of occurrence of new episode of the disease arising in any of the population, where the new incidents or new cases have been seen into that particular population. Whereas there is a cumulative incidence where time interval is expressed as fixed period, result is expressed as a proportion. So if we have a continuum or a longitudinal study, we have to go to the population again and again. In that case, we have cumulative incidence, like in first part, so many new incidences, in second part, there are some incidences, and in third part, there are some incidences. So cumulatively, we have to interpret about our study. There are some specific incidence rate, like attack rate, used only when the population is exposed to risk for a limited period of time. For a limited period of time, in a flash of some time, if the population is exposed to that particular risk factor. For example, any epidemic. Secondary attack rate is number of person exposed to the risk factor for developing the disease within the range of incubation period following exposure to the primary case. So the one person he has been exposed to a particular risk factor, he has not developed the disease. He's still into incubation period. But by that being a carrier, how many people he has affected, that is known by secondary attack. For example, study of infectious diseases. So uses of incidence data gives clues to research into the etiology and pathogenesis of the disease, helps with the study of distribution of disease, helps in taking action to control the disease, and useful in evaluating the efficacy of preventive and therapeutic measures. Second thing is prevalence. The total number of all individuals who attribute or disease at a particular time divided by the population at risk of having the attribute or disease at this point in time or midway through the period. So whoever people you know that they are having disease, they come under prevalence. Whether they have been diagnosed 20 years before, 10 years before, 1 year before, 1 day before, or they have been diagnosed right now during your study, does not matter. Whoever is having disease, that comes under prevalence, not like incidence. So current cases will be, that means the cases who are prevalent, they'll be having old as well as new cases at a given point of time and in a given population. So there are types of prevalences, like point prevalence means one point of time. You go to the population only once, cross-sectionally only once, and find out how many people are having disease and how many people are not having disease. That is called as point prevalence, where there is a period prevalence, where over a period of time you want to see that population over a period of time, like 10 years, 12 years, or whatever, according to your study. So over a period of time, how many people have developed that particular disease, that will give you a period prevalence. So this is the formula of point prevalence and period prevalence. What are the uses of prevalence? Useful in estimating the magnitude of the disease and health problems in community. So what is the magnitude? How much is the burden of that particular disease? Helpful in identifying the potential high risk populations. That means the people who have high risk to that particular disease. Useful in administrative and planning purposes, like assessing manpower needs in health services delivery or health services, etc. That means to find out how much manpower, how much material or equipment or the money, financial needs, other things you need in that particular prevention or curation of that particular disease. So there is a relationship between prevalence and incidence that is shown in the formula, which says that prevalence is equal to incidence into mean duration. That means if the duration increases, prevalence increases. If the incidence increases, the prevalence will increase. So in today's lecture, I've finished with the introduction of epidemiology. From the next lecture onwards, we'll be seeing the epidemiological studies, the steps, those are there, and what are the biases of that particular study. Okay, thank you.